make the blood flow again to the heart tissue. Okay. So when people suffered a myocardial infarction, quite often after that, the heart doesn't function that well. It cannot pump the blood around in the body as well as it did before. And when blood is left behind in the body that is not properly pumped around, then you can develop a heart failure. So there's different possibilities for heart failure, that the left part of the heart doesn't function well, or the right part of the heart doesn't function well. And the left and right heart have different functions. So the left heart pumps the oxygen-rich blood into the body, and the right heart receives oxygen or pumps the oxygen-poor blood from the body into the lungs. So it depends also where the problem in the heart is, what the symptoms will be for the heart failure. The heart failure you can measure by the amount of blood that's left in the heart after a heartbeat, and that should not be too much. When it's more than when less than 40% is pumped into the body, then it's called heart failure. And there's a formula. That's the amount of blood, that's the stroke volume pumped into the body, and then the amount of blood that's left in the heart. And if you take that ratio, you have the ejection fraction. And that's a clinical measure for heart failure. So there's two types of heart failure again. Some have a problem with the ejection fraction, and the others have a preserved ejection fraction. So that's two different types. I won't discuss them in detail because that's part of the clinical week. But now you have heard at least that there are two types of heart failure, with preserved ejection fraction and with the reduced ejection fraction. And when you look into medical records in the hospital, you can always see that the doctor tries to distinguish these two types of heart failure. So please have a look at this yourself already, that you are prepared when we have the clinical week. You have heard about these terms. For me now, it's only to introduce the terms to you, not to discuss them extensively. This is the introduction week. Then we have the peripheral artery or peripheral arterial disease, PAD. That has to do with the narrowing, because of atherosclerosis, of the arteries in the lower leg. And that's a disease that can be rather painful when it develops into intermittent claudication. Then there's really a cramp also in the calf muscles because of lack of oxygen. That's very painful. And we call that sometimes shopping window disease, or window shopper's disease, I should say, because people walk on the street, they get cramps in their lower leg, and then they pretend they are looking into the shop window just to stand and to relieve the pain. So it's also called the smoker's leg disease. It's quite common, and it happens also a lot with people who have diabetes. So you can diagnose PAD by measuring blood pressure in the arm and in the lower leg, and then take the ratio of the blood pressure. And when it's below 0.9, then it's a diagnosis of PAD. We call that the ankle brachial blood pressure index. So that's the ankle arm index. That's a synonym. Do you get this? That it's not too complicated. Eh? Take the ratio of these two blood pressures, and that's used for diagnosis of this disease. Okay. Another major disease in cardiovascular disease is thromboembolism. So when you have that artery in the leg that has atherosclerosis, when there is a blood clot formation, it may become an embolus traveling through the body and end up elsewhere in the body. And for example, it can end up in the heart, in the coronary arteries of the heart. You may develop a myocardial infarction. So it can also start in a carotid artery, like in the neck. Then it may end up in the brain. So this is often a reason for a stroke. When the blood remains in the heart too long, you can also get clot formation in the heart, because blood should flow. If blood doesn't flow, you get clotting. And a blood clot in the heart can be pumped through the carotid artery in the neck into the brain. Well, there is a disease called atrial fibrillation, which causes not an effective way of blood pumped out of the heart. It just stays in the heart too long because of the fibrillation of the heart. And the atrial fibrillation is a disease that is a risk factor for a stroke, because if the blood stays there too long and it's not effective pumping mechanism, then you can develop a stroke. You can also have in the veins, you can have the thrombus formation, but the veins bring back the oxygen, poor blood to the lungs, and then the thrombus ends up into the lungs. So then you get a lung embolism, and that's really also a severe disease. So it has a different origin. A lung embolism comes from the veins, and so as the ischemic stroke comes from the heart or from the peripheral arteries. So that's different. Okay, so when we talk about stroke, there's also a synonym for that, which is cerebrovascular disease or cerebrovascular accident. That's also used, CVA. So CVA, stroke, CVD, but then for the cerebrovascular disease are also synonyms, and there are different types of them. You have the blocked brain artery. That causes an ischemic stroke. The word ischemic means lack of oxygen supply. Then you get ischemia. Then the thrombus that I just explained, then it comes from elsewhere, then it's an embolic stroke. Or you can have a rupture of a blood vessel in the brain. And that can be caused by atherosclerosis, but can also be a weak spot in a brain artery. It can also rupture. And then you get a hemorrhagic stroke. So that's a bleeding in the brain. So these are different types of stroke. You also have what we call a TIA, a transient ischemic attack. That's also a kind of brain infarction, but then the symptoms disappear within 24 hours. Then it's kind of mini stroke. Strong warning sign for getting a real stroke. So here I have some pictures of different types of stroke to explain it even further. Do you think these different types of stroke have different risk factors? Does it matter what kind of stroke it is? But why would you distinguish between these different types of stroke? Any suggestions from your side? It's a difficult question because it's only the first lecture today. So maybe I can help you a little bit. When it's a weak spot in a brain artery, it's probably not caused by poor nutrition. It can be a congenital defect, for example. Then you have a different etiology, a different reason why the disease occurs. When you have an atherosclerotic stroke, ischemic stroke, then it has the same kind of risk factors as a myocardial infarction. For example, high blood cholesterol, high blood pressure, these kind of risk factors. So if you want to study the impact of saturated fat intake with stroke, I would rather choose ischemic stroke as an endpoint in my study than a hemorrhagic stroke. Because the ischemic stroke is caused by atherosclerosis, and then you will have the pathway from saturated fat to high LDL cholesterol, building up of plaque in the arteries, and then you will get a stroke. So